walk us through that one.
Well, that one is the theory.
Yeah, okay, so that's what do you want to go to that now, or do you want to go to...
Sure, let's go to the theory first.
Okay, let's do that. So we already have that open here, so here we go.
Lucky you. Lucky viewers. You know, I always get this from my students and people who read it. This is what showed up in the textbook, and they go, you expect us to memorize that? And I went, well, you know, you should have tried being the guy who developed it. Okay, so right, there it is. Now. I'm not sure how well it will work for me to point to it. But let me just say that if you go to the, can you see, I don't know, you probably can't see what I'm doing. Okay, if you go to the upper left-hand corner, you're going to see a bunch of circles. Yep. That's an artery.
Okay.
And what this whole cross-section is part of an artery. And the stuff that relates to the infection is all on the right half of it. Believe it or not, the left half really takes things into account like the cholesterol and the triglycerides and oxidative stress and homocysteine, which can be related to stress, and lipoprotein little a. The right half really looks at the entire set of things that and I don't have a way of really pointing to it and making it work on this, but the right half of the image looks at how the immune system works together to address infections and all the different components of the clotting cascade, things like glycoprotein 2A, 2B3A, fibrinogen, which goes up with problems with these infections, and also goes up when you give people plasma, when you give them the antibodies for plasma. And then you have just the different white blood cells involvement. So it's complicated to go through, but the point is that it was laid out in great detail, and it shows 13 various factors that play a role in heart disease and cancer. And this is why, and forming blood clots. And this is why people with these viruses end up forming these blood clots in the end and having the inflammation and swelling. And then that inflammation and swelling, when it occurs in the lungs, interferes with the lungs being able to get fluid in and out. And that's one of the reasons why people have ended up going on ventilators. The problem is that while everybody was panicked about having enough ventilators, because as I tell students, it's easy to put somebody on a ventilator. Once you learn how to intubate them, put the tube in, and attach that to the ventilator, then somebody who's smart enough, a doctor with experience to know how to set the ventilator, or the respiratory therapist comes in to get things going, who will typically ask the doctor, what do you want for the settings on the ventilator? Then you can have the ventilator take over the breathing for the patient. The tricky part is getting them off.
Yeah.
Because any moron can put you on a ventilator. It takes somebody with a little bit of skill